Hey everybody, it's Tuesday, it's 3 o'clock, that means it's Tech Tuesday. Today I'm going to be talking about telehealth services and also particularly the CARES Act, which is something that is helping to fund that, and I'll be right back. Thanks for joining me again. I'm Rick Uzzi, VP of Marketing here at Zquorum, and the topic today is telehealth services. And this is something that's kind of timely right now, as you can imagine. As you can see my background here, I am still social distancing on the Tech Tuesday, so we're all trying to work remotely as much as we can while the pandemic hopefully starts to fade, but we're all doing what we can as part of that. And telehealth services, as you can imagine, has been in demand and quite popular since this has taken place. There's a couple of things going on with that I'll talk about today, including the CARES Act. So what is it? It's something that's been around for a while. Telehealth is one of those things like Internet of Things and IPv6 and Y2K, whatever, that people talked about for a long period of time. And then all of a sudden, obviously with Y2K there was a date, but all of a sudden things start to roll on it. And what's given telehealth kind of a boost, obviously, is the fact that we're in the middle of a pandemic. But it has been around a while. It's been talked about, but just recently there's been a lot more focus on it. This cartoon right here is from 2012, and it's a really good example or description of what telehealth is. You've got this remote situation with your doctor where they can view you maybe via camera, see what's going on with you, maybe have some diagnostics there where they can diagnose an issue through the camera and through other devices so that you don't need to go physically to the doctor. Obviously, there are going to be times you're going to need to go to the doctor, but if you can check things out and get diagnosed remotely, that's good. That's always been good for people that are maybe in rural areas where they've got a long drive to the doctor. They don't have access maybe to good health care. And today, as we're in the middle of a pandemic, it's been very important to be able to do this to help keep other patients safe and keep doctors safe, and with a lot of activity to keep help the doctors be more productive. So it's been something that's been very needed, especially now. So here's an example of how it's impacting doctors. So this particular doctor, for the last 3 years, I guess, is averaging like 10% of the patients that were using telehealth or the digital health platform that she talks about, and it's gone up to 95% with COVID-19, and you can see why. And she's saying, we're starting all encounters for our clinic via telehealth, and then we're bringing people into the office. We already know they need to be there. So they're probably handling a lot of things remotely. Maybe people that are afraid they might have COVID, they might talk to them, get their symptoms, say, oh, you should be fine, take 2 aspirin, go to bed or whatever. And then obviously if the person is experiencing symptoms and those kinds of things, they tell them to come in. But this is an example of how this is being driven on the side of the doctors. And this is an interesting survey that just came out. And it highlights a couple of different things here. One thing it highlights is that a lot of people feel unsafe when they go to the doctor, in the doctor's office. In this case, most people feel safe at the doctor, but it does say 57.8% feel safe, but the rest are unsure or don't feel safe. And that goes down. Fewer and fewer people feel safe when they get to the hospital and when they get to the urgent care. So I think that's always been the case for a lot of people, because you think about, well, I'm going to go to the doctor's office, and then you got all these people coughing around you and sneezing, and it's like, am I going to get sick? And now with COVID-19, there's probably a lot more uncertainty or fear about that. So that's one thing that's highlighted. And then also, it shows that people are more interested than ever in telehealth options. At one point, it was 25%, it says, had not used it previously, but 36% say they would now change their healthcare provider based on that being an option. So obviously more patients are interested in it, more doctors are now interested in it. As far as on the device side, you can see here that this is driving demand for telemedicine devices in that market. It's expected to cross 7.9 billion by 2026. And that's been boosted by this whole thing. It's having an impact on companies that provide that kind of equipment. Here's an example of a company that has just secured some funding. They make devices including a connected stethoscope, a high-def camera to evaluate dermatological issues, an infrared thermometer, an otoscope, which is the thing they use to look in your ears, and a tongue depressor adapter. That's kind of interesting. I don't like tongue depressors. Actually, my tongue only goes down so far, so the doctor can't really see in the back of my throat. It's this weird thing I have. I don't know what that is, but anyway. So I hate tongue depressors, but this is some kind of tongue depressor adapter that can be done remotely. And they were actually already using these things. The 12 patients from that Diamond Princess cruise that were Israeli, this is an Israeli company, were actually monitored using this equipment, from what I understand. This company now is going to use this funding to help them expand in Europe and in Asia. So you can see the devices are already there and ready. I guess that's the tongue depressor on the right. So this is, again, an interesting outcome of COVID-19 is there's more things driving this telemedicine market now and the equipment that's there. So let's talk about the CARES Act. So this is something else that's come about very quickly. This is the Corona Aid, Relief, and Economic Security Act, and that was signed into law on March 27th. It moved very quickly. It appropriates $200 million that's going to flow through the FCC. It sounds kind of odd that it's the FCC, but there's a reason for that, for telehealth initiatives. And again, you can see that the FCC got right onto this. So the law was signed into place on the 27th. And on March 31st, the FCC created the COVID-19 telehealth program, which is going to be what's managing the funds. So it really did have a fast track on that. The purpose, according to the Act, or according to the, I think according to the report and order by the FCC, says to provide immediate support to eligible healthcare providers responding to the COVID-19 pandemic by fully funding their telecommunications services, information services, and devices necessary to provide critical connected care services. So this would help fund the broadband connections. So if you're a broadband operator, you need to realize that there are some healthcare providers out there now that may be looking to implement this, and this could be more business for you. So it could be good for you to get up to speed on this, including what they might need to do to apply for these funds. It also will fund the devices, so that those devices we were just looking at, it would fund stuff like that. All the things that they would need to be able to provide this telehealth service is going to be covered here. And this $200 million will stay in place until the funds are expended completely or until the pandemic has ended. So there's a window for applying from that perspective. There's not a deadline. It's just a matter of if the funds are still there, and then is it still considered a pandemic. So there are some eligibility requirements for healthcare providers, although this covers probably just about everybody. As you can see here, this is a long list. And at the end, it even covers consortiums of healthcare providers that are maybe one or more of these particular other categories. So it applies to a lot of particular providers. So how do you get the funds? Well, first, and this again, it's funny that's going through the FCC. You don't think of the Federal Communications as being health, but there's a reason for that. So step number one is you have to apply for a form, or you have to submit a Form 460, and that's to USAC, which is the Universal Services Administration Company. And you have to put in documentation and go ahead and do this form. Now, if you're a broadband operator, this might sound familiar, especially if you're doing VoIP, but I think even broadband services, a lot of broadband operators are having to file these forms with the FCC, which you would expect with the FCC. So again, if you are a broadband provider, you might be able to help guide your healthcare providers through this process. That could be something that you could help them with. And again, that could help your business as you're providing more services to them through telehealth services. So the USAC, that's, again, the Universal Service Administrative Company. And if you've gotten your phone bill, if you've looked at it closely, you see a USF charge on there, Universal Service Fund. And that funds things like, it was originally for funding phone service in rural areas, and now it's lifeline phone services and internet services. Funds broadband services in high-cost areas, again, usually rural, where it's very expensive to deploy, and rural healthcare. So part of the USAC now is rural healthcare. That's been the case, and that's why this program is being done through that. The other thing that you need to do is register for an FCC registration number, an FRN. Again, if a broadband operator or VoIP operator is watching this, they're very familiar with that probably, or at least the people who fill out the paperwork to get that stuff. So that's required. And the FRN, if a healthcare provider happens to have one already, or whoever's going to be doing this, they can use that one, although the FRN needs to be the registration number of the person that's going to be completing the form. So if you have an existing number, you just need to make sure that that person is the person completing the form. You submit an online application for funding, and on the site there's more information about that process. The site right here, that URL, there's a lot of information about the process, and there's a link to the application form. And then there's a systems of award management site that you need to go to, and this is so that you can get the funding. If you were actually awarded the funding, this is how you get it. And they recommend, the FCC recommends that you go ahead and complete this process before you receive your funding decision. So you need to be registered there so you can get the money, and you want to get that all in place and not wait until you actually get your money before you go ahead and do that. There's some required application information that I'll kind of go through here that might help if you're wondering how hard is all of this. And it's not that onerous. It could be worse. Again, it would help to have somebody guide you through it, but there's pretty good information on the FCC website. But of course, you got your contact information, and that's going to be the contact person for the FCC that they would contact about this. And then, of course, the healthcare provider information, contact name, the FRN, tax ID information, DUNS number, the entity, and then patient counts would be the total patient population that the healthcare provider has, and then how many are expected to be treated via the funding request, the telehealth services that are being funded by this. Services and conditions is another section of the form, and this would be where you just list the telehealth services that you're going to be providing and the medical conditions that are going to be treated via that. Purpose of the funds, the goal is to target the areas that are hardest hit by COVID-19. So that's one of the things that they ask for. So they want to know what your goals are, the timeline that it would take you to deploy it, how you track that, and then again the COVID-19 impact, and that is a factor in there. So if your area is particularly hit hard by COVID-19, then there's going to be a better chance, I guess, that you'll get the funds. Although I don't know how much of this, I don't know how much they're actually holding back. There's $200 million. The most that they've said they would award any one provider would probably be $1 million, and that would, I would think, be a big provider. So there's money out there that you could probably get if there's any kind of impact, I would think, on COVID-19 in your area. And then funding request, you've got to tell them the amount of funding that you want, the type of funding, what it's going to be used for, if it's devices, how they'll be used. All that information is on the form that you need to complete. And then finally, you go through the certification process. So once you've filled out this entire form, then there's a list of items that you're going to agree to, under penalty of perjury, I might add, but you have to agree to that you're authorized to submit the application, that you're verifying that all the information is correct and true, that you understand, subject to state and federal laws, including the Federal False Claims Act, anti-kickback status, and other kinds of things that would come into play here that would be something that you would not want to get on the wrong end of. That you understand that the documentation must be retained for 3 years, and that would be 3 years after the last person that you treated related to these funds. So, and that you would also certify that this particular healthcare provider is not going to be getting funds from any other source to fund this stuff. So if you're getting funds from the state or any other place that's helping you to fund your telehealth services, then you're not supposed to apply for this. And then lastly, that the goods and services must be used for their intended purpose. So obviously they don't want you taking money under this and then paying staff, that's not related to this telehealth services, those kinds of things, or buying equipment that's not related to that. So that's all important. And again, if you want to look into this, again, if you're a broadband provider and want to see if you can help telehealth or healthcare providers get into telehealth, or if you're a healthcare provider and you're interested in learning more and actually starting the process, you can see the link here to go to. And again, there's a lot of information there. to be able to go through that process. So how long this is in place, we don't know. The pandemic, at some point, they will officially call that over, and then that will end the distribution of funds here. Or if they run out of money before that, then that obviously will end the distribution of funds. So this is something that's available to healthcare providers, to that list that I showed you. So it's worthwhile looking into if you are a healthcare provider. Again, telehealth services is not going away. I think a lot of people are realizing now that it's gotten this boost from this pandemic. It's one of those unintended consequences that could be a good thing in a way, because it provides opportunities to do some things remotely and be more efficient with healthcare. So it's probably not going away, and this is a way to get some of that funded in this particularly tough time or challenging time, where we've got a lot of people that are either sick or afraid they might be sick, and they don't necessarily want to go sit in the doctor's office. And the doctor needs to be efficient in how they see those people. So, all right, well, thanks for joining me today. And if you like this video, go ahead and just click the little thumbs up below the video. Go ahead and subscribe to our channel and ring the little bell, and you'll be notified anytime I am live or we post a video. Thanks for joining me for Tech Tuesday, and I will be back next week with a new topic. I'll see you then. Bye.